Disclaimer: this podcast is for educational purposes only. I am not a doctor, and nothing in this episode should be taken as medical advice. Always consult a qualified healthcare professional before starting or changing any treatment, supplement, or peptide protocol. Today we are diving into a fascinating peptide known as AOD 9604. This peptide is a fragment of the human growth hormone, specifically the C-terminal portion of the molecule. Researchers isolated this fragment because it appeared to have the fat-burning benefits of growth hormone without many of the unwanted effects that come with full hormone use. AOD 9604 was first developed in the 1990s by scientists in Australia. They were studying growth hormone and wanted to find the section responsible for its impact on fat metabolism. Through research, they identified amino acids 177 to 191 as the active sequence. This is where AOD 9604 comes from. So, what exactly does AOD 9604 do? The main effect is to stimulate lipolysis, which means the breakdown of stored fat. At the same time, it also inhibits lipogenesis, which is the formation of new fat. This dual action means it can help reduce fat accumulation while supporting fat utilization as energy. Unlike full growth hormone, AOD 9604 does not seem to affect blood sugar, insulin sensitivity, or growth factors in the same way. This is important because it makes it a potential option for weight management without the same risks of insulin resistance or excessive growth of tissues. In animal studies, AOD 9604 showed promising results in reducing body fat, especially in regions like the abdomen. Some human trials have also been conducted, mostly focused on obesity and weight loss. The results suggested modest but noticeable fat loss effects, particularly when combined with healthy lifestyle choices. One interesting aspect is that AOD 9604 may also support cartilage and joint health. There is some evidence that it can help with repair of cartilage tissue and may be useful in conditions like osteoarthritis. While the research here is still developing, it adds another potential layer of benefit. When it comes to how people use AOD 9604, it is usually delivered as a subcutaneous injection, meaning just under the skin with a small insulin needle. In some cases, it can also be compounded into capsules or troches for oral or sublingual use, but injections are the most common and effective route. Dosing protocols can vary, but the common range is around 200 to 500 micrograms per day. Some protocols use higher amounts, while others use it in combination with other peptides. People often take it once daily, sometimes in the morning, other times before bed. It is important to note that while AOD 9604 is generally considered safe and well tolerated, it is still not approved by the FDA as a prescription medication for weight loss. It is often sold as a research peptide, and availability can depend on local regulations. Side effects appear minimal, with most reports mentioning mild injection site reactions like redness or irritation. Another consideration is that results are not typically dramatic on their own. AOD 9604 works best as part of a comprehensive lifestyle plan, including nutrition, exercise, sleep, and stress management. People sometimes get discouraged expecting it to melt fat rapidly, but in reality it seems to support gradual, steady fat reduction. Because AOD 9604 is related to growth hormone, but does not increase IGF-1, it does not appear to carry the same risks of promoting abnormal cell growth. This makes it interesting for those who want some of the fat-burning advantages without the long-term risks associated with hormone therapy. Now, let's talk a bit about research beyond fat loss. Some studies suggest AOD 9604 may have regenerative properties in musculoskeletal tissues. It could play a role in reducing inflammation and helping repair damage in joints. This could make it useful not only for people looking to manage weight, but also those recovering from injury or dealing with chronic joint pain. Another area of investigation is its effect on metabolism overall. Some findings indicate that it may help regulate how the body processes energy, possibly improving fat oxidation during rest and activity. Again, this is not a magic switch, but it could nudge metabolism in a healthier direction. In the peptide community, AOD 9604 is sometimes combined with other compounds. For example, it may be paired with peptides that promote muscle building or appetite control. The goal is to create a synergistic effect, enhancing fat loss while maintaining or even increasing lean body mass. If you are considering AOD 9604, it is important to weigh the pros and cons. On the pro side, it offers fat-burning support, has minimal side effects, does not interfere with insulin or blood sugar significantly, and may promote joint and cartilage health. On the con side, the effects are modest. It is not officially approved as a treatment, and quality control of peptide products can vary widely depending on the source. Because of these factors, guidance from a knowledgeable healthcare professional is essential. They can help determine whether it is appropriate, how it fits into an overall health plan, and how to monitor progress safely. Let's imagine how someone might experience AOD 9604 in practice. Take a person who has struggled with stubborn abdominal fat despite eating clean and exercising regularly. After consulting with their physician, they begin a protocol of daily injections. Over several weeks, they notice their midsection looks leaner, their energy improves, and they feel less achy in their joints. While it is not a dramatic overnight transformation, the steady improvements make it worthwhile. On the other hand, someone who expects rapid weight loss while continuing poor eating habits may be disappointed. This highlights the importance of realistic expectations. Peptides like AOD 9604 can be helpful tools, but they work best when combined with consistent effort. From a safety standpoint, long-term data is still limited. So far, short-term studies and anecdotal use suggest good tolerance. But as with any compound, ongoing research is needed to fully understand its risks and benefits. It is also worth noting that AOD 9604 has been explored in the sports world. Because it is a growth hormone fragment, questions have come up about whether it is considered performance-enhancing. In fact, it has been listed by the World Anti-Doping Agency as prohibited for athletes. So, if you are involved in competitive sports, it is important to be aware of those rules. The bottom line is that AOD 9604 is an intriguing peptide with targeted fat loss potential and possibly joint health benefits. It is not a miracle drug, but for the right individual under proper guidance, it could make a meaningful difference. As always, the best strategy for health and body composition is a holistic one. Nutrition, movement, recovery, and mindset form the foundation. Peptides like AOD 9604 can add an extra layer of support, but they should never replace the basics. Disclaimer: this information is for educational purposes only and should not be used as a substitute for professional medical advice. Always consult a qualified healthcare provider before starting or changing any treatment, supplement, or peptide use. Thanks for listening, keep learning, and stay curious.